Okay, good afternoon, everybody, and welcome back to this series on families in India. This is the third of the series, third and the final of the series of the webinar that we are doing now. And today's topic is on kids and elders in the family. So we have a very interesting panel today, and to moderate this session today, we have Dr. Matthew Burgess with us. He's agreed to come back and moderate this session. So he's the former professor and former head of the Department of Psychiatry. He also headed the Family Psychiatric Services for almost 30 years. And he will be moderating today's session. So,
thank you, Santosh. So, welcome to this third program in the series of families and issues in India. Just to recap, in the end of July, we had a session on families in India and looked at the different aspects of changing families in India. Then, early this month, we spoke about families in crisis, where we talked about families which are having problems and families which had difficulties, both due to mental disorder or chronic disease, and also due to discord. And this is the last in the series where we are going to talk about the extremes of age, both with children and also with elders. So we'll dwell a little bit about the issues that are present with families which have these kind of members. And so for that, we have a very distinguished panel here. We have Professor John Vijay Sagar from the head of the Department of Child Psychiatry here, Child and Adolescent Psychiatry at NIMHANS. We have Dr. Sojan, who's again working in psychiatric social work, and he's worked with adults and with elders. He's from the Department of Psychiatric Social Work. And we have Professor Keshav Kumar, who's again a professor in clinical psychology. He's worked for many years with elders, especially in the area of cognition and other aspects. So welcome to the panel. And so I'm going to just start off by asking each of you all to give just a couple of opening statements about what you think with regard to the family and children or elders, as the case may be in your respective cases. So I would start maybe with John, talk about a little bit about what you see as the family with regard to the role of family with regard to children and adolescents.
Thank you, sir. Children, they form about 39% of our population in our country, and in a family, children form an important component of the family. And as Sir had mentioned in the introductory remarks, that they are at the one extreme of the life cycle. So the childhood, that is from the birth of a child to that of the 18 years, is a very crucial period of development of any individual. And a family's role is very important during that period. Families provide a lot of nurture and support during the phases right from the birth of the child to the time the child finally becomes an adolescent and then transitions into the adulthood. The support of the family during these phases, right from the infancy to that of the adolescence and later as they transition to adulthood, is a very important factor. And family support and the caregiving what they provide plays a very important role in the overall functioning of the children. So,
thanks, John. And I think I'll also ask you to think a little bit about how families with children have been affected in some ways during the COVID. We discussed a little bit about that last time, but I want to specifically talk about how families might be important with regard to development of children, because I know that the development of children has been drastically changed because of they can't access schools and they can't do so many things. So I wanted to think and talk about a little bit about it a little later. So let's come to Sojan now and his experience with dealing with families of people who have got elders. And I know that you worked a little bit in this area with regard to, I know you run groups and other things with regard to families who have people with dementia, people with depression, other kinds of elder families. So I just ask you to talk a little bit about the role of the family with regard to the elders in our country.
So thank you so much for inviting me to this discussion. So for in India, if you see, the scenario is the primary support for any individual. The family offers the primary support. See, I always used to tell in group therapy, the best insurance company for any individual in India is family only. So they are the one who takes care of everything, starting from seeking treatment, ensuring treatment, recovery, rehabilitation, all parts. Family is a co-therapist almost. So in that scenario, family's role is very, very important in geriatric care. Along with that, aging itself is a new phenomenon in India. So in that context, even children, the topic itself I felt very good. So children should get role model not only to become husband and wife. They should even get role model how to be an elderly in the family. And as per the new law also, it is not our choice. You cannot say that it's cultural value, like taking care of family members. Taking care of elderly, as per law, now in India, if you are not doing, it's a punishable crime. That even grandchildren, if they're adults, they're supposed to contribute for the welfare of elderly. Another one last point as an introductory statement I just want to tell is, for any elderly, if they wanted to mentally and physically healthy, they need to be socially engaged. In India, considering the unemployment rate and all, it may be difficult to get the employment after 60. In that context, the grandparents can do a huge amount of responsibilities in terms of socializing the younger generation. As we know, the sociology point of view, any biological being is transferred as a social being. Like by birth, any human being is like an animal only. How to get that cultural and spiritual and family values, somebody has to infuse that values through stories, songs, through telling the history, traditions. Grandparents, elderly have a huge role. In that way, if you think, giving space for elderly, it is mutually benefiting task. And the final one more point I just want to tell, we need to think now whether our home or the public facilities, are they elderly friendly, including the toilets. I just want to know, many times fall happens in toilet because it is not designed for elderly. So I think I say culturally, India is for caring elderly in the home, but it needs a lot of guidance, technology, support for ensuring the overall well-being.
Yeah, I'm glad you highlighted that change in focus, in the sense that I think even when I started, I talked to you about how families might be responsible for elders, but I like the way you flipped it around and said that elders are also assets for the family. Some of them might be working, some of them might look after children, and more than should we look after elders, we can also talk the other way about, what is the asset of the elder in the family? I mean, various people like psychiatrists like Jeste has talked about wisdom of elders. So wisdom, this whole quality of wisdom is something that obviously can be imparted to the whole family. Among other things, in addition to caregiving and other kind of aspects, wisdom with regard to many kinds of decisions in the family can be imparted. And so I think what he said is that it's a two-way phenomenon. It's not just elders are there and you should look after elders. It's both ways, I guess. Yeah. So let's stay on that thought. And I think when we talk about the family, I am particularly happy to look at the framework of life cycle stages, which both of you referred to. Life cycle stages are things that families go through when the child is born, when the child is going to school, when the child is becoming an adolescent, or when the adult launches out, or and then when they become elderly and people retire, and then what happens? So looking at a family from the perspective of a life cycle is something that I find it very useful from a family therapy or a family exploration perspective. So we'll talk a little bit about that also as we go along. Now, to talk to Professor Keshav about what I want to specifically, I'm waiting for your opening remarks, but I would also like you to think about what is the responsibility of the family in terms of development, psychological development of both adults, of children, adolescents, and also elders. So in addition to your opening remarks, at some stage, I'd like you to sort of allude to that also.
Thank you, sir. Good afternoon. So it's a real beautiful continuum of child to elderly, from children to elderly. So how family has to take care of children. As we age, we also need to take care of our elderly, because at one end of the spectrum, we are looking at development of cognition, where the child is not fully ready to deal with the external world, where they need supervision to guide the child through various blocks in life or through various goals of the life. As we grow up and the brain reaches its highest level of functioning, which actually happens around 25 years of age, there's a constant decline. But the decline is not very exaggerated till about 45 years. But 55 onwards, you can see cognitive decline very evident. So as we age, there are three things that will happen. So the early stages of aging is something known as age-related cognitive decline. So all of us, as we age, forget names of students, forget names of people whom we have seen some years ago. So that's one stage. And the manner in which we interact with the environment also becomes a little slow, and we stick to routines and we're good at routines, but we are overwhelmed with new things that come up, even with normal aging. The next stage is an interface between normal aging and clinical pathological conditions like MCI or mind cognitive impairment and dementia. So the progression from normal aging becomes much more exaggerated as cognitive decline in MCI. And in MCI, they are not typical to their age groups in terms of the cognitive decline. So that's how the families pick up these. And the next stage is dementia, where many domains of cognition gets affected. So the role of family becomes extremely crucial, even in the healthy normal aging, to facilitate their everyday activities, which may not be impaired, but small bit of help with that. But as we go into MCI and dementia, it becomes very important to give them that information that they need, where they don't get overwhelmed and alarmed that they become anxious and confused. So that information is very crucial. And the stage also is set so that we maintain the independence of the person as they age.
Right. So it's interesting what you said about cognitive development and also psychological development of children and adolescents. But when we talk biologically about the plasticity of the brain, from a psychological perspective, from a cognitive psychological perspective, would you say that an elder person would not have any further cognitive or psychological development with regard to his emotions, his behavior, and so on? Is it that everything is kind of frozen at 25, and so people don't elders don't develop further, or how does it go?
That's a very important question. So some domains kind of start plateauing, but some domains, like you started with wisdom and those things, knowledge gained over a period of time keeps improving. So there are certain domains of cognition which improves, and knowledge and other things also can improve in one particular domain. What really stagnates and starts falling down is the ability to deal with the new environment. As we age, it becomes much more difficult to deal with abstract thinking and not non-routine kind of activities. While there's development emotionally, there's much more emotional maturity. The impulsivity of the youth is gone. As we age, we take decisions that are much more calm and level-headed as we age. So it's not really frozen like that. So there's an improvement on multiple domains. At the same time, the crux of cognition may slowly start slowing down.
Yeah, so I think that issue relates to what Sojan said earlier on about elders being able to contribute in some ways to the family. Might not, some of them might be voluntary because many elders continue working till the age of 70 or beyond. But also in terms of giving advice, providing knowledge, providing, childcare or providing other kinds of inputs as far as the family is concerned. Now, let's move on to another area which we talked about, and that is the life cycle stages and progress from one to the other. I just want you all to sort of discuss a little bit about how a family who has either children or adolescents or elders, how they might deal with different issues in these two spectrums, either with children and adolescents or with elders.
First, when we take up the age group of children and adolescents, we see that it's again like it spans from the birth of the child itself. So I would start by saying that the preparation for the birth of the child itself, like as the parents are doing that, so that's a very crucial phase, and especially for the mothers, like during that period, pregnancy period, their health and maintenance of their nutrition, those aspects are very important because the development of the fetus starts within the mother's womb, and it has been identified in several recent research studies that any adverse impact on the maternal health during that time can have an impact on the fetal development. And once the child is born, also like it, for the family members, especially for the parents, that brings about a lot of responsibility, new responsibilities, especially caregiving of that child in the initial few years. And in terms of development, the initial 3-year period, or sometimes even initial 5-year period, that's 0 to 5 years, what we call, that period is said to be very crucial as significant brain development happens during that initial period. And that period, what the child requires is a lot of stimulating kind of interactions with the parents and the other family members. And mainly in terms of the language stimulation and also stimulation of the social skills, these two domains. And of course, other developmental areas also has to be addressed in terms of the motor development and also the cognitive development of the child. And as the child moves beyond this phase, in like once the 5 years of age completes, once the child enters the stage where the child can attend school, preparing the child for this phase, like for the school entry, that is very important. And also we see that many a time, like parents have to spend quality time with the children, ensuring their optimum development on one hand, and also once they start their schooling, significant amount of time is spent by the parents in supporting the academic activities in the home context. I think balancing these two things during that phase, and as they move beyond this phase, once they enter the adolescence, of course, the schooling part will continue. With the adolescence, actually, there are onset of several developmental changes. And these changes happen within a short span of a few years. And these changes include that the adolescents, they start becoming more and more independent. They don't depend on their parents for their usual activities of daily living. And also the adolescents are able to judge situations more appropriately. They are able to take decisions on their own, and they're likely to, because that is a phase where they are developing their own identity. They try to discuss most of their issues with their peer group rather than with the parents. And during that phase, like compared to the earlier phases where the dealing with the younger children, the parents have significant challenges in providing the support to the adolescents. And also what we see is during this phase, there may be a lot of issues related to academics also, especially the academic stress. And due to the rapid developmental changes, this is a period where they are at a significant mental stress also, and this can lead to onset of mental health issues during that time, adolescence. And as they transition to adulthood, also some of these challenges they continue. And as Dr. Keshav had rightly pointed out, recent research has shown that some of these brain development changes they continue even till the age of 24, 25. It's not that just with the 18 the person becomes adult legally and the person is able to independently function like maturely like an adult. Some of them they continue to have challenges even into their second decade of the life.
Yeah, I think it's very important because I think a lot of research, as you said, talks about how brain pruning occurs all the way up to 25. And so many behaviors, challenging behaviors, might actually get extinguished if brain development occurs properly all the way up to 25. Now, what you said about development is very important, and that is you trace the development of children from infancy to preschool to school and then adolescence. In the first session that we had a discussion in July, we talked about how Indian families are changing because what has happened in the 21st century, whatever was happening in terms of less socialization, less engagement, less play activity, less interpersonal contact, and more reliance on gadgets like the computer and digital devices. We spoke about how these things might actually sort of make the millennials, the Gen X, Gen Z, different kind of individuals. And this, to my mind, in some ways has been exacerbated in the last 2 years because of COVID, because socialization has come down. There are children who are passing out of school without having ever met their friends, school or college. There are kids who are preschool who have never gone out to play with their friends. So that is an exacerbation. But even before COVID occurred, would you both say, both from a cognitive, interpersonal skills, psychological skills, developmental skills, has it been challenged? And if so, what do you all think the family can actually do? What is the role of the family in terms of providing these interpersonal skills, cognitive skills, psychological skills, the ability to sort of, deal with stress, and cope and deal with stress? Now, what would be the role of the family in doing all these things?
So first and foremost, I would like to say that the developmental aspects, what I had briefly mentioned in my earlier reply, families need to develop a good understanding of the developmental aspects from the infancy till the time of adolescence and of course later. And they have to be clear about what kind of supports are required at different ages and stages of the child's development. For example, like somebody who is below the age of 5 years, as I mentioned, requires a lot of stimulation in terms of their language skills, social skills, etc. And that is basically a very crucial period. It's also called the critical period of development, where you put that foundation. And that's where, like, what is important for the families to do at that time is to ensure that they spend some quality time with the children. As you mentioned, it's not with the gadgets and things like that, which we are seeing in the contemporary times. It's through regular interaction, communication with children, talking to them, telling stories, and giving them different kinds of experiences. That's very important. Unfortunately, in the COVID situation, we have seen that there are several restrictions on that. Otherwise, also, like, they need to provide those kind of, like, for example, play is something which you mentioned that's very important for a child's development. And the play play doesn't mean that we take a gadget and play some video games on that. Play has to be very interactive, and there needs to be communication during play. And the person who plays with a specific object has to at different stages. Like for example, initially small children, they'll engage in what we call pretend play. That's very important at the stage. Then they will have to develop to a level where they are able to play with the other child. So as initially with one-to-one and later with a small group, and following certain rules and instructions in that play, and taking turns, that becomes very important. Those kind of experiences, child should not be deprived, and the parents have to ensure that whatever be the other schedules, certain time has to be allotted every day to the child to do that. And even if there are restrictions related to the COVID, within the home, actually they should ensure that at least one of the parent being available at times and interacting with the child and playing with the child. So as to ensure what we call an experiential kind of exposure to the child, preventing the experiential deprivation. That is very important at that level. And that needs to be continued once beyond the age of 5 also, once they are at the age of 6 and till the adolescence. What becomes important at that time is allowing them to practice the skills what they are learning. So communication, not just like, for example, the interpersonal skills. They have to interact with their siblings, parents, grandparents who stay at home. And then also, at least with the immediate neighbors, those kind of experiences have to be provided. So that is invaluable actually, that needs to provide those experiences. And then during the adolescence, slowly as they are developing their identity, and also when they are developing a certain level of autonomy and they are able to take decisions, what is important is they need training in what we call life skills, wherein like how to handle their emotions and the interpersonal skills, then decision-making skills. All these things have to be provided through the adolescence. So when parents, right from the infancy through the adolescence, when they make efforts to provide these things at appropriate stages, it will, I would say that it will act as it's like taking the vaccine against any infection or anything like that. So it's a kind of immunization what we do for our children as to how they can face the stress as they're going up. Right from the birth of the child itself, the child faces stress. So through the adolescence and as they enter adulthood, they'll be ready with some amount of resilience to handle the stresses.
Thanks, John. Just to tell the audience that we will take another 10 minutes or so asking questions of the panelists, and then later on, we will respond to some of the questions or comments that the audience might have. So maybe Santosh or somebody else can monitor what the questions that are coming up online, and then we'll answer them in about 10 minutes time. But just want to stay with this and talk to Keshav or Sojan about this whole issue. And this is what we discussed in the first session, and I'm glad it's come up again. That is, without diminishing sizes of families. Now families are nuclear. There's only mother, father, and maybe one child or two children. Right? Forget COVID, even before COVID. And the mother and father, dual working couples. Mother and father are very busy. And so spending time with the child, single child or two children, and then having, play activity with the neighbors, all very challenging things. Even before COVID has made it totally different, but even without COVID, it was challenging. So my question to both of you is, and also now new families, young families. Earlier on, they were grandparents, and then they would tell them, okay, what can be done, what should be done. And there was always that innate knowledge about what needs to be done in the family. But now with new families, where is this knowledge going to come from? I mean, most people don't read about this on the net, read about parenting on the net. They think they all have the skills to do it. Is it that they all have the skills to do it, or can they read it from somewhere? And how can they gain this knowledge? Obviously, everybody cannot come to a psychologist or a psychiatrist or a mental health professional. So where do they gain this knowledge from? And how do we ensure that this kind of thing happens? And let me give you an example. Many times, pre-COVID, I've had the experience of traveling on trains or planes with an infant, with a toddler or a school-going child. There are two types of families that I see. One type of family is where during the train rides are longer, flights are shorter. But even those half an hour or 1 hour on a flight or a 8-hour journey on the train, one kind of parents just hand a gadget like this to the child and then hope, and then the children are playing on the gadget, and the parents are reading their book or playing on their own gadgets. Other type of parents that I've seen is that the mother or the father would have had a bag full of various play items. Might be a book, might be some toys, might be some puzzles. And then throughout the journey, you can see one or the other parent sitting and engaging with the child. So there are two types of contrasting families that are there. And many times I think to myself, it takes some effort, but if the parents were to take these things along, books, puzzles, gadgets, not these kind of gadgets, but other kind of gadgets along, I would think that you could have that engagement. And like you said, and this is something which in family therapy or with families of people who are either adults or elders or children, one of the things that we prescribe as family therapists is a routine and daily activities, a ritual, a family ritual of having playtime, having time when the child will go in the evening and play with the neighboring children, or having time when the parents will sit down and play with the children, or reading a story, or reading bedtime stories, or playing a puzzle. These are all times that a family, in the old days, I would say families would slot. Now they don't, because everybody is busy. You are on the call. Your office never finishes at 6 o'clock. It goes on late at 12, or sometimes even 12 o'clock. And people are so busy. So how do you advise families? Because they all don't come to us. How do you tell families and how do you do it?
So very interesting issue that you have raised. And I see COVID as having something both positive and negative in terms of family. The positive thing is that the family is together.
Correct. They are thrown together.
Yeah. So I've seen many families, parents spending a lot of time. The children never even understood what the parents can do besides their computer work. So COVID gave us an opportunity to see, observe what the parents do and learn a lot of skills from the parents, like cooking from the mother, all the carpentry stuff and household chores from the father. So lots of such things happened. The bonding got better because they stayed at home. Of course, there were other kinds of families which never ever interacted because they were busy still working from home. So many parents realized the need of the family to be together and they set aside one time to interact. So that's where elderly parents and the children come together because they said, okay, dinner we're going to have together. So that's where informal interactions, narrating experiences, listening to stories. So like you said, where does this information come from? So it has to be passed down from the father or grandparents. And in families that doesn't have a grandparent, probably the father would say that when I was a child, this is what my father did. So that's one way to gain experience. If the grandparents are there, it's an additional thing because you have 3 generations of learning. Like I was saying, abstract thinking cannot be done after, it's not diminishing after a point. But this experiential learning that they have imbibed from their own parents is transferred through stories and narration and experience. So COVID brought all this together and we've seen so many children spending time with the grandparents, learning skills that they never even have heard from the parents. So COVID has done this. So many papers also write that spend quality time with the children and have 1 hour of no gadget time where you just chit chat with the family to bring in that skills and interaction with the family.
I think I also just wanted to tell something here. So for any families, they need to communicate. Communication is the central point. So to communicate, you need to have certain skills. It's not easy to learn communication skills. At the same time, you also
communication, I would say also negotiation.
A negotiation.
Because this is something that many
not easy. It's not easy to learn. Even in workplace, we see the difficulties in communication. And then another thing is problem solving. it's very easy to read in a book how to solve problems, but practically solving the problem is very difficult. And waiting for results. I think the best psychotherapeutic word from India I have ever heard is from Sri Krishna only. Do your duties, don't wait for results, results will emerge. So there are a lot of philosophical things are there in India, which can be utilized for even in corporate world. So these three elements, so what Sarah was telling, I also felt that play is not just for a physical activity. It's not an activity for pleasure. It's a learning opportunity for anybody. I think, unfortunately, we do not have play items for elderly. Time has come. We need to think about what kind of items we can use for elderly. I think Keshav sir should agree with me. The cognitive stimulation or sensory motor stimulation in childhood, cognitive stimulation for elderly can be done during the family rituals. So combining these three things with a common goal, we can save time. At the same time, it will be having a lot of creative outcomes. One final point from my side. See, like, in forum and all, when we go, we see that if you purchase 2 shirts, 2 pants, you will get 1 free. In aging also, what I wanted to tell, if you live healthy life in 30 years, first 30 years, second 30 years, you will get another 30 years as a bonus. This message gradually only coming to India. I think Apple phone I got within a short time. Apple 12 release, immediately I'm receiving. The message of aging, I think from America or the Japan to India, it's not coming by flight. I think it is by walking only it is coming. We have to accept the reality that we need to invest for aging. We need to invest for relationship. We need to invest for our peace of mind also. Most of the time we forget that fact that we need to invest. So many times extramarital relationship and all, why people are getting into, because they forget to invest in relationship. So I think these are the few things from social work dimension. I think we need to remind Indian families.
One of the things that's very interesting about investment,
Yes.
and taking time to teach some of these skills, coping skills, problem solving skills, the need to wait for satisfaction. This gratification is something that everybody wants quickly. So I was reminded of what happens with this no school business during COVID. This is something that was there earlier also. If schools are not there and it's a holiday, there is a big problem because parents don't know what to do with the children. Now, like we said, COVID has put them together in one house, whether we like it or not. So I think, and then many families I know, they've shut up house in cities like Bangalore, and they've gone to the villages. In fact, many houses are lying empty because they've all gone to the villages. They're all working from home. There are 3 generations. And that's something that, like I said, the good part of COVID. So the investment is very important because many times, in the old days, and this John will know, the parents would go and complain to school, in school meetings, PTA meetings, they will say, what is it that you're doing? How come you're not teaching this or teaching that? How come you're not teaching my son or daughter to be obedient? Because they spend 8 hours in school, parents think that the school should take care of everything. There is no investment by the parents, in either the children or in the elders. There should be some investment. I think investment is a very important thing. The social investment, an investment in the family, an investment in relationships. I think it's a very important part that you highlighted. Thanks. Right. So it's about 3:50, and then we should end in about 15-20 minutes or so. So I'm just asking were there any questions online, any comments online, or anything from the audience here itself, or any other things that you want to add? Santosh, if you can just tell us if there are any questions online.
One of the things I would like to add,
yeah, sure, please.
Context
please,
is that for parents, I think first and foremost, for every parent or every family member, whether it's a grandparent or parent. So when it comes to that child, they have to understand that child. So every child is unique, and it's not that they have seen some children, then I have understood this child better. So in that child, actually, what are his strengths? What does he like? He or she like? And what is his temperament? That's also one important thing, like when it comes to parenting. So basic nature of the child. So some children, they will have what we call an easy temperament. They will interact with everyone and they're quite adaptable, and their mood is stable. Whereas we see some of the children, like they have problems. There's something called difficult temperament. They get very moody, and they have the delayed gratifications are what you mentioned. So they are not able to do that immediate gratification, and they have issues in controlling their impulses, and they could be quite stubborn or demanding. They have a very low frustration tolerance. They were very sensitive. There are also certain group of children who are not very sociable, who are shy, and who have very limited number of friends, who keep most of the things to themselves. They don't open up very easily. So I think parents have to understand the child's temperament, and also, as I mentioned, the development of the child, the likes and dislikes. And as Dr. Sojan pointed out, whatever the skills they impart, right from the birth of the child, that is to be seen as an investment, because this is for the future. And I think every parent has to think in this way, saying that for my child, I'm investing, and tomorrow as an adult, he will function much better. And as he moves on to the life cycle stage of an elderly, he can guide actually the next two generations. So that way, in the entire nation, actually, it will be like we'll be investing in the future of the nation. Of course, like in a country like ours, we, in terms of population, we are the largest. We'll overtake China within few years, and especially in terms of the child and adolescent population, maybe in 15 years or 20 years, we will definitely overtake China, and we will become the largest country with child and adolescent population. So I think it's important for us. It's right now. It's not somewhere down the line. So right now, in the next 10, 15 years are very crucial for us to invest in children. And of course, in improving their skills and the interpersonal relationships, that is very important.
I know in terms of resources, both in child psychiatry and also in geriatric psychiatry, there are some resources available on the net.
Yes.
And I think both these two units have put up the sort of things on the NIMAN's website, isn't it? You have a website, and then
Biomancy Sanjeevani is a website bringing all the materials together.
Similarly, I think you also have a website. So, other questions? First of the sessions is not available on YouTube. That I think somebody can address. It is available, you said. No? We can address it with the education there. Yeah. So to the question on this first session is not available on YouTube, we'll try and get it. I think some of them watched it.
Second session is available.
Yeah.
First session.
We'll see how we can put it up. Okay. So what are the questions? Post a question. What is that great metaphor? Somebody says great metaphor. What is a metaphor? How can families help the elderly? No restrictions during the elderly. Parks and small gatherings cut off. Yeah, Sojan, you want to answer? Or this Keshav, you want to answer?
Yeah, like Dr. Sojan used this term, invest.
Yes.
It's a very important term. Like Dr. John also said, invest. So I think for elderly, they have to invest in physical health by doing physical exercise like yoga. If the parks are not available or closed, some kind of activity at home, physical activity. They must invest in mental health by learning to cope, meditation, to deal with their anxiety. Most importantly, they need to invest in their brain health by doing cognitive activities, mentally stimulating activities. I've seen many elderly who are extremely active before retirement. They go into very sedentary lives just after retirement and say that, I'm retired now, I'm a retired person. So they don't really engage in any activity. So it can have a negative effect on the brain health and cognition. So I request the audience to be engaged in mental health and cognitive activities to keep the brain stimulated and agile, because that's an investment, and it will procrastinate if there's any kind of illness, it can at least slow down dementia for people who are susceptible to become dementia.
I just want to add on another thing to this question which Soumya has asked. See, earlier on in COVID, it was said that elders shouldn't go out, they shouldn't go to parks and all that. And many resident welfare associations and buildings and all that brought restrictions.
They had banned it.
They banned, and they said no newspaper, no mail, no nothing. You know? But if you look at the recent data, we know that if you're out in the outdoors, in a park or wherever it is, you're wearing a mask, the risk of getting COVID is extremely low. In fact, almost no risk, you can say. You got a mask, you're out in the open where there's enough ventilation and breeze, very unlikely to get COVID. So I would say to Soumya's question that, and I keep telling elderly and other people, I keep advising them and telling them that, you can go out. Who said shouldn't go out? You should go out, walk around the building, walk around your, compound, walk around on the streets, walk in the parks. Just wear a mask. Don't go close to people and then congregate. You can't have laughter clubs and all those kind of things which is close and where you're laughing and singing and all that. But wear a mask, go around, definitely you should go out. That should definitely be something that is done. So I think we should now start advising our elders that they should go out. They should go to parks. They should do exercise. And as Keshav said, cognitive and physical exercise is very important. Again, I joke with some of my elders. I'm also an elder, but I tell patients who come to see me, like Keshav said, they'll come and say, now I'm 65, 60, I'm retired. I'm going to have a happy retired life. So I said, what are you going to do during retire? They say, no, I'll travel, I'll read paper, I'll read books, I'll do various things. I said, okay, fine. How many years are you going to do that for? Then they say, no, I'll keep doing it. So I said, how long do you think you can do it? 5 years, 10 years? When will you get bored? Then they say, no, I've not thought about it. Then I say, how long do you think you're going to live? And then they are sort of taken aback because, you're retired at 60 or 65. And then you think you're sort of, you've finished everything and then, that's it. So many of them would say, well, I don't know. Okay, think, how long did your parents live? Or how long do you think people live now? And invariably, you'll find that most people will get another 20 years. Most people live till 70 or 80. With the given, they are healthy otherwise. Given the current circumstances, they live till that. So I say, okay, what will you do for 20 years? Then you start thinking, like you said, okay, what am I going to do for 20 years? You need to make a plan and invest for 20 years or 30 years, as you said. Like you said, 30, 30, 30, 30. You need to make a plan and investment for 30 years. So post-retirement is not easy. And families need to make a plan. Because it is very easy to say, oh, my mother and father are retired. They're going to live in some house somewhere. Okay, but what's going to happen? What's the plan? They have to have a plan. There's another question about how to support adolescents.
Yes, sir.
So
what we see is in some of the parents that during the initial period, that is during the childhood period, they will engage in what we call as a very permissive style of parenting. They will allow the child to just get anything what they demand and they'll not put any limits. And whereas once that phase is over, as the person enters into the adolescence, that is when the parents suddenly try to become very restrictive. They will put so many conditions saying that you can't talk like this, you can't do this, you can't do this. And that's where actually the adolescents start showing certain behaviors.
They should have done that when they were children.
Yes.
Right? They don't do it when they're children.
Setting healthy limits should start in the childhood itself with regards to certain behaviors. And in the adolescence, mainly I mentioned earlier also with regards to developmental phases, they are developing their identity at that time, and they are likely to be more autonomous in their functioning. They're less dependent on the parents, and they like to get into these peer groups, and they like to discuss some of the things in the peer groups. They are likely to expect more privacy from the parents. And for example, at home also, an adolescent may suddenly say that, no, this is my room, like
Right.
so when I'm talking to my friend, no, I don't expect you to come and disturb us. Like, no, I need some privacy. So some parents, they feel that, why my child is hurting me, like, what is his privacy and confidentiality, this kind of thing I don't understand. And also with regards to decision making, also many parents, they don't allow the child to make, the adolescent to make any decision. So everything they don't want to decide, like whether what food they have to eat, what clothes they have to wear, with whom they have to make friendships, and whether they have to choose this particular hobby or that hobby. So everything the parent wants to decide, and that's not good. Like wherein graded way, actually during the adolescence, the decision making has to be provided to them. And the parents are supposed to support and guide that process. And by the time they become adults, what we need to remember is that we have to encourage the independence gradually, and then when they become adults, they have to make several decisions. So this can't happen in a day. So over a period of time, they have to encourage them. And also another important thing is in the interpersonal relationship, the trust. So many times we see that parents not trusting whatever the adolescents try to communicate. And what happens is after the initial encounters, the adolescents themselves, they become very secretive. So they feel that whenever I try to tell something, my parents blame me, or they don't believe my version, whatever it is. So better not to tell the parents. So they hide everything from the parents, and even some of the serious things also, like suppose they are experimenting with some substances, say they started smoking or drinking, or they entered into some kind of romantic relationships. All these things they hide from the parents, and if there are any crisis situation, that also parents will get to know at the last moment. So rather than that, I think what is required is, Dr. Sojan has very aptly highlighted the communication.
Yeah.
So with adolescents, a open, honest communication is something very important. And more importantly, parents have to be good role models.
Yeah.
So many times, like, as parents, we see that some of the people, they themselves, they spread gossips about others. And they are not very truthful, and sometimes they don't maintain a regular routine. And the family rituals which you highlighted, many parents themselves, they are not interested.
Correct.
And many of them itself, they always are on the gadgets. And then they try to impose things on the adolescents, saying that you should not use gadgets. That's not going to work. So first, try to be a good role model. And this is not easy, actually. This is a process. So no parent becomes a 100% effective parent on day one. So this is a process. As long as you remain as a parent for that adolescent till he develops into an adult and he separates and he has his own family. So till that time, and in our country, we see that we continue living together, like as families. And even after marriage, also our children, they live with us.
30.
After 30, so unlike in the West, where after a certain age, like 12 or 13, so they go, like suppose if they have to pay some college fees, parent will contribute something. That fellow will go and work in as some pizza delivery boy or something like that. He'll learn. Another thing is we'll have to teach them that the importance of hard work, putting in efforts, and also some amount of humility and getting along with others, and the importance of relationship. That is very important. And also in terms of academics, parents should have reasonable kind of expectations. The adolescents, that's something I mentioned initially, especially when they are, what we see very commonly is when they are in the 10th grade or 11th, 12th, that phase. So there is a lot of academic stress, and of course with a lot of this competitive exams and all these coaching kind of institutes, there is a lot of stress on them. And parents should not rub their expectations onto the adolescents and unusual high expectations, and also comparing with other adolescents, saying, see, that guy is an IIT or she's in AIMS, I want you to be there. No, maybe he will do well in
Something else.
the local engineering college in Jaipur. That should be fine. And or his passion is not engineering at all. He will do something else. Yeah. Right. So that is something they have to understand and encourage.
Yeah, I think what you said is very important, that from the parents' side, they have to acknowledge the individuality of the adolescent.
Yes.
And let them
and I think that starts from the childhood, sir. Like treating that person as an individual, that is very important, because so that child also has a personhood. and he or she has a sense of agency. That is very important. So we'll have to respect that. And whenever they try to communicate some of their experiences, validating those experiences, rather than saying, you don't know anything. Say, I am 30 and you are just some 6-year-old or something like, what are you telling me? You don't try to teach me. So those kind of interactions are
They're close,
very common.
They close all communication
And
down.
in fact, what we see is in our culture, one particular thing that children often face is it's very high. In fact, recently some of our students also, they have done some studies, what we call emotional abuse. And earlier, I think a lot of physical abuse was happening, but now we are not hitting our children very much. But still, we continue to actually emotionally abuse them. Like we just put down and we criticize them at even the slightest things. We compare them with others, and so all these things continue to happen. So that needs to change, and we need to value them, their experiences, and as I mentioned earlier, treat them as unique individuals and get to know of them, their values and their strengths.
And the other thing that you said is that children need to learn negotiation. Because many times they don't know what to do. They just demand, okay, give me 1,000 rupees, give me a bike. And then it's a tantrum, no? So they need to negotiate and say, okay, why do you want 1,000 bucks?
And also from
why do you want to buy?
Make it clear saying that what is reasonable, what is not reasonable.
Yeah.
And also setting that limits from the beginning itself, rather than like I just give a very simple example and end that. So in the OPD one day, we had seen one child like where the parent was saying they had come from Tamil Nadu, and the parent said that this child, sir, he is demanding some cars and all this. So initially we thought, like myself and senior, we thought that it was actually some play cars, all this Hot Wheels and all that stuff. But actually the guy was demanding cars, the real ones. And they had one Honda City, even it was expensive kind of thing, Benz cars and all. Though they could afford, but for that age, he didn't require all these things.
No, he was an adolescent who was
demanding, and
he couldn't drive it.
He couldn't drive, but he just wanted to go around. He would arrange a driver or something. So you can see to that extent, they were very permissive.
Okay. How to manage stubbornness? I think that's been answered a bit. Can you also put up the list of other participants so we can, if anybody is there, we can sort of call out to them and ask them. Stubbornness, I think you want to mention anything about stubbornness in child and parents? Parents also. They will ask stubbornness.
Yes.
Elders, stubbornness and elders?
See, that's what, now after joining in Imhans,
participants.
I was thinking that there is a good guys and bad guys. But after spending time in Imhans, I understood there is no good guy, there is no bad guy. If brain is not functioning properly, so the people can, if brain is not functioning properly, people can become extremely stubborn. So I think we need to understand the pathology, and then we need to have a proper inputs for them to handle
that. Just click on that. Yeah.
Matthew sir disrupted my comment. I want to repeat it.
I'm sorry.
It's okay. I just want to tell, sir.
No. I think this thing about stubbornness of parents.
Yes.
Many times, we as, if I have a mother who's 90 or 80, I tell her what to do. It's not correct to tell them what to do. Just like he said about respecting the individuality of the children.
Elders also
expect the individuality of the elders. Many times you say, you come and live with me. You know what my mother told me when she was 70? He said, if I come and live with you, it's your house, your friends, your TV program, it won't be my house.
Yes.
So after I shut up, I kept quiet.
No, that's the problem with the proverb also in India. 6 years and 60 years should be treated equal, same.
Yeah.
So that proverb actually misguiding, because 60 years also people have preserved, well-preserved cognitive or ability to take decisions.
Yeah.
I think sir will agree.
No, people can have good cognition even at 80.
80s and things like
we see very sharp people who can reason very well.
So you cannot treat them like a child.
You can't generalize that statement that cognitive decline will happen to everyone.
Yes.
There are so many older people.
So a lot of elders object to being treated badly by children, in the sense that telling them what to do. Yes. You don't know how to manage your finance, give it to me, I will manage it.
In fact, with children, that's what, like when I mentioned the role models, parents as role models, parents should teach the children that one, like saying that at no time, like you should allow others to take you for granted and treat you without respect and all this thing, but you should also be similar, like same way to others. Even with the elderly people also, you should treat them with the respect and same age group also.
Any other questions? No, just, no, you don't have to put it on, just put that list is enough. Video may not be there. Anybody else online who wants to say anything, you can unmute and say anything. Or anybody in the audience here wants to say anything? Anything to add? Yes, please.
Just one question.
You want to come closer so that you can answer. Okay, you ask and then we'll repeat your question.
Yeah, so how do parents and children deal with the diversity issues? For example, parents who are single parents from divorce backgrounds or children with special needs. So how do we sort of manage these?
How do parents manage
Parents and children coexist with these diversity.
with different problems? You're saying.
Yeah.
You're talking about divorce, or you're talking about separation. You're talking about
Divorce, separation.
single parents.
Yeah.
What mention?
So
We covered a little bit of that in the last second session, but
I think that's a very important question when it comes to parent-child relations. Like suppose if you have a single parent, I think it's very important for the parent first to understand that as a single parent,
you can speak this way.
they will have to fulfill those roles that are required to support their child. It could be one child or it could be more children. As a parental role, what we traditionally see as two parents fulfilling that role, it now falls upon that single parent to handle, like supporting the academic activities of the child and also ensuring the optimum development by doing all the things what we mentioned in the earlier discussion. Then also the single parent also could be a working father or mother. So they will have to, they are the breadwinners for the family. And it's not very easy actually being a single parent. And they need to, and also it depends on whether they have any other supports. Like for example, sometimes we see that their own parents, maybe they're supporting them, or could be some of their good friends. So it's very important for them to stay connected with some of these people because being a single parent fulfilling these kind of roles, it's going to be very stressful for them. That is one thing. Second, when it comes to issues like parents getting divorced or parents getting separated, and one of the parents having to take care of the children, that is something oftentimes we see, or even after the divorce, when one of the parents gets legally the child custody kind of thing. In our country, what we see is that the children are not adequately prepared for it. So that is something we need to actively think and we need to work on that. Like because oftentimes what happens is that the parents who have gotten into that situation would have had relationship difficulties for several weeks or months or years. So that ends up in the separation or divorce. But at the same time, I'm not saying all of them, but some of them, they don't prepare the children adequately, like for this phase. Like after the separation, what is going to happen? Like where the children are going to stay, who is going to provide them with all the support what they require, and even the legal process that happen around that time. So many times the parents themselves are stressed with that, or the other family members, adult family members are stressed. So there is a period of this experiential deprivation for children that's likely to be a period of experiential deprivation for children. That is the second scenario. Third one is with regard to children who have developmental issues. So it could be any developmental condition, whether it's intellectual disability or autism or ADHD, whatever it is. The parents, first and foremost, they need thorough understanding because they play a very important role. In fact, whatever the supports the child gets, either at school or in the form of some therapies by professionals in institutions, finally it comes to that particular parent to act as a very active person to support this child in their needs. It could be, say, for example, a child with say autism spectrum disorder, say developmental condition. the child will require a lot of training skills for the social development as well as the speech and language development. So whatever exposure child gets in the school environment or even when they take for therapy sessions, it is limited. But at home, they have to, the parents have to understand and provide that kind of support to the child. And only then actually the child will be able to attain some kind of meaningful things.
Right, I was just looking at the time and, we are reaching about, we've gone past 4:15. I think we should end soon. But if there's any other comments anybody has, no other comments online, there's some more comments online?
One more.
Yeah, I mean, Dr. Shadavan was mentioned in the Reader's Digest, I think, recently, isn't it? Yeah, but I have a lot of people who I know in my family and my wife's family who are all 90 plus. They're all learning new things. Some of them are learning how to use the computer. Some of them are learning, and they're all independent, living on their own. And with of course contact with the children and all that. So there are many examples. I mean, I think all of us would probably know many more people who are in the 80s and 90s. So just like the sterling example of Shadavan who was more than 95. Anyway, any other comments or questions? I think okay, if there are no other comments or questions, I would thank all the participants. I think there are almost 40-50 participants. Thank all of them who came online, and then I thank the panelists. I think we had a very good discussion from John, Sojan, and Keshav about adults and elders and children in families. I think this is something that can be an ongoing discussion. We just finished the 3 sessions with families, which I asked the Health Education Department. Santosh, you can probably ask them to put all the videos up online because people would like to see them.
Sure.
And I think Sojan has watched some of them later on. So like that, I think put all of them online. You tell Meena and others so people can watch. Thank you very much, everybody. And thank you very much to all the panelists and to Santosh for putting it all together.
Thank you.
Thank you.
Thank you.